So when Daijon came in, he had difficulty walking. We could tell that right off the get-go. He was having issues with both of his back legs and had a very abnormal gait. But he was a very happy puppy. We suspect that his issues was something he was born with, that his kneecaps just weren't aligned in the proper place, and then as he grew, that chronically deformed his limbs into very bowed legs compared to what your normal dog would have. This is a condition that is difficult to treat because it's not a simple surgery, and it's not a surgery that many can actually do. You have to go to a specialist that has done this before, and there's very few that do it. So we did end up over time looking at consultations with different specialists to see who was able to potentially do it and who was willing to try, and basically had to travel multiple days just to consult on this condition. Both places were concerned that his left leg was pretty much not going to be usable with the amount of muscle loss and issues in conformation that he had, even if he had surgery. Over time and discussion with the surgeons, we did realize that he was probably better off not having surgery on the left leg, and that is where we did proceed for amputation. We ended up doing a consult to get him fitted for a cart, since we knew we would be amputating that left hind limb. To make him more comfortable, the cart would give him the easier mobility of supporting his hind end and allowing him to run around. That made him much more comfortable very quickly, where he was then able to get around easier with his right leg, which was also malformed, but he was able to get around easier, not having that added weight holding him back. With some time, he has gotten used to the cart and is able to run around a lot more freely than if he was just continued to be aided by us with a sling. This gives him a lot more freedom to be a bit more of a normal dog running around.